Hi, Tuck Bierbaum again. I'm the medical director for Survival CPR and the medical director for medical services at Berkeley's Alumni Camp, Larry the Golden Bear in Pinecrest. I want to talk briefly, mostly to our EMTs, to answer one question. Hey doc, does this cut need stitches? Okay? And so sometimes that's a little bit of a complex decision-making pathway, but not really. So let me give you some guidelines. Number one, if you look at it and you go, holy moly, this thing needs stitches, you're probably right. Now, on the other hand, if you're not quite sure about that, here's some guidelines. The wound generally should be greater than 1/2 centimeter in length. The reason we select that is that if it's less than that and still quite a deep wound, we might not even suture that anyway. So it should be greater than that. And number two, if the wound is spreadable and you can see tissue underneath the skin, such as fascia or muscle or connective tissue, then that will be spreadable, and that one needs stitches if it's greater than 1/2 centimeter in length. Now, when can a wound be closed with stitches? And in general, it's on the hands or feet, the wound can be closed in 8 hours. On the trunk, 12 hours. And on the face and scalp in 24 hours. So there's time to get this repaired if it's an inconvenient time for the patient. Recognizing the longer the wound goes without being thoroughly cleaned and sutured, the greater infection risk. But those guidelines I just gave you generally apply. So what can you do? Clean the wound with a local anesthetic around the area, and then irrigate it copiously with ideally sterile saline. But if you don't have sterile saline, just large amounts of clean water will do. Then put a dry dressing over it and have the patient see a practitioner as soon as possible to get the primary closure done. The reason for having a patient to go down and potentially get stitches is not just to get the stitches, but it's also to ensure that thorough cleaning is done to reduce the chance of infection by retained foreign material in the wound. So that actually is one of the most important things when people are referred for stitches. In fact, physicians might not even close the wound ultimately, but they will do a good job of cleaning it out. So that's the reason we do what we do with stitches. Hope this has been a helpful guideline for you.